Hey, hey, everybody. Welcome back to Dr. Cece Says. Y'all, we are back and it is Mental Health Awareness Month. Last month, y'all, I was doing a lot, had a lot of great opportunities, and I can say I really missed being here. I really missed interacting with you all in this way. And so I was thinking about that and I had to smile because I remember last year, maybe around March, is when I did my first Facebook Live. Y'all, I was all sorts of nervous. Okay. I had a script ready, I had my support system on standby. I was getting pep talks, like all sorts of stuff, because it's scary sometimes to put yourself out here and to be on social media and not know how you'll be received, right? And also, being a perfectionistic type person, right? Not understanding that everything doesn't have to be perfect. Things aren't going to always be perfect. And it's amazing to me that a little bit over a year later, like y'all, I be missing it when I'm not here with y'all. I be missing y'all. And so, like always, if you are here, drop hi, hello, what it do, what up in the chat so I know you're here with me. If you are catching the replay, drop hashtag replay in the chat. All right. And I see we got some folks on. Hey, sis. Y'all, my sister Tasha is always here, always available. The consistency with which she shows up on Dr. Cece Says is how she shows up in our relationship, in our sisterhood. She is that consistent all the time. So thank you, sis, for being on. Yes, and she said, definitely have been missing Dr. Cece Says. And y'all, I've been missing it. I've been missing y'all. But let me tell you about what I did in April. Let me tell you how God moved, okay? So, had a lot of different events and different opportunities that I was doing. One in particular was the Elite Retreat, the Elite Mastermind Retreat in Pompano Beach, Florida, for 5 days. And y'all, it was everything. And let me tell you, we were supposed to be there Thursday through Tuesday, but the weather decided that it was going to act up around Tuesday, Wednesday. And so Fort Lauderdale flooded. And Pompano Beach, if you don't know, is not far from Fort Lauderdale. And so Fort Lauderdale flooded, the airport at least, and other areas. And we couldn't get there. Like 80% of the attendees were coming in from other places, and we could not get there. Flights were canceled. They tried to reschedule us. They tried to send us to Miami. They told us to, hold tight in Charlotte for like overnight. It was a lot happening. And I'm just so thankful for how God has grown me, right, for one. And so my husband and I got the text message on our way to the airport that our flight had been canceled. And so, luckily we didn't make it to the airport. We weren't stuck at the airport. And so we called, we got the flights rescheduled, and y'all, there was this sense of peace that was there, and this sense of excitement. And that's what I told my speaking coach, who was the host of the retreat. I said I was actually excited for what was coming because I knew that it was going to be good. I knew that God was going to send a word. I knew that God was going to send some blessings, some supernatural blessings. And that is why we had these barriers, these obstacles that first day. And as always, God did not disappoint. So we got there, and y'all, we had a great time. We learned, we leaned into some rest. We talked about ways to change our mindset. We talked about ways to be bold. And so I haven't even made my post yet because y'all, I've been moving and running. But once I sit down and make my post and you all see some of the pictures and some of the videos, you will get a glimpse of what a blessing it was. Hey, Bri, I see you on here. Yeah. So, also, after that, the next weekend, I was the keynote speaker at the 52 Rebuild Women's Conference in Mobile, Alabama. And for those that don't know, I used to live in Mobile for a couple of years, and I have not been back since that time. So it had been about 16 years since I had been in Mobile. And oh my goodness, it was nice to be back in the South. I love Maryland. I love that we live up here. Technically, Maryland is the South, but they don't always know that. Okay. But Mobile, Alabama is the South South. Okay, it's real Southern, and it's a whole lot of sweethearts and sugar and hey baby and all of that. And I enjoyed every minute. And the conference was absolutely amazing. I don't think it was recorded. I really wish I could go back because the minister that gave the word on Friday night was amazing. And also the word that we got on Sunday was amazing. And y'all, I'm not a minister. Y'all know that, right? Like, I am not a preacher. And God still gave me a word for the people. And so that's just a little something that I have been seeing across April. What God has for you is for you. You do not have to be like everybody else. You do not have to be, quote unquote, called for a particular task for God to use you in that task. So even though I was not a minister, I was able to be the keynote for the prayer breakfast on that Saturday. And I think it went well. I heard that it was a blessing to people. And so what we talked about was how God will give you beauty for your ashes. And I talked about specifically hope, loss, and resilience. And I actually shared a little bit about my grief journey. And y'all, that was the first time that I shared about my grief journey in one of my talks, like it as extensively as I did. And so I was a little nervous about it, but I knew God had laid it on my heart. And so it went well. And so that was a blessing. And then last weekend, I had the pleasure of doing the Healthy Kids Day for the YMCA in Baltimore. I was one of the vendors. And so we went out, we set up our table, and I was talking about mental health. And so many families, so many kids came up and had questions about what is a psychologist? And what is talk therapy? What all do you do? And how can that help me with symptoms of ADHD? Or, do you all help people figure out their plans when they go to college? There were so many questions, so many good questions. And there was this really cute little black girl, and she came up and she looked at all of the paperwork I had up there, and she asked her mom a question in her mom's ear. And her mom kind of encouraged her to say it out loud. And so she looked at me and she asked me, "What is a psychologist?" And so I gave her my answer, right? I gave her an appropriate answer for her age. And her eyes got like really big. And she looked and she said, "Oh, wow, that's what you get to do?" And y'all, that just made my heart melt. And it made me realize before that moment, she had probably never seen a psychologist, one, and two, a psychologist that looked like her. That probably was not in her sphere of thinking or possibilities at the time. And hopefully it is now. And that led me to thinking about Mental Health Awareness Month. And what does it mean for the month of May for us to be talking about mental health awareness? And for me, what it means is helping people understand that mental health care is a resource, right? This is something that's a pro. It's not a con. This is not something that is, and I'm talking about therapy, assessment, even medication management. These are not things that are punishments. These are not things that we should be ashamed of. These are things that are helpful. These are things that we should be using as coping strategies. These are resources that we should be tapping into. And unfortunately, a lot of times communities of color do not tap into these types of resources. So, whereas I'm talking to everybody and I want mental health awareness to be a thing for everybody, I absolutely want it to be a thing for communities of color and for people of color. Okay. So, while I kind of start talking about what we're going to talk about today, I want you all to drop in the chat. And the people that are on, that I can tell are on, I already know that you all know a little bit about mental health, but drop in the chat what has been your understanding of mental health care. What is mental health care? What does it include? So y'all start dropping that in the chat for me, okay? Now, when I think about mental health awareness and given the experience that I've had plenty of times, but specifically last weekend, I think about how a lot of times, y'all, we will know that things are not going well, either for us or for people that we care about, and we just don't know what to do with that. Like, we don't know where to start, we don't know who to ask, we don't even know, like, okay, what type of specialist or what type of provider should I even be looking for? And so I wanted to talk a little bit about that today. Right. So, with mental health care, right now, I'm specifically talking about therapy. I'm also talking about assessment. And if you don't know what assessment is when, let's say, you want to know your IQ, or you want to know your learning style, or you want to know if you have a reading disorder or a math disorder or another type of learning disorder. You will go and have an assessment done, right? And so you have different types of providers who can do assessments. But a lot of times with those assessments, they will give you recommendations and they will give you diagnoses, right? And so let's say we're talking about a kid and you think this kid might have ADHD. They can go and do an assessment and they will either get the diagnosis or they won't. And let's say they get the diagnosis, they're diagnosed with ADHD, then they're given a list of recommendations. Here are the things that you all can do at home to help this kid. Here are the things that the school can do to help this kid. And here are the things that maybe you all can participate in the community that will help your child. Right. And so you take this report and you take it back to their other providers, you share it with the school, and then you get the kid the supports that they need. So kids are not the only ones that can have assessments. Adults can have assessments done as well, right? And then we also have medication. Now, medication can be a touchy subject. Even for the people that I see in therapy, medication is a touchy subject, right? Because you have side effects. Parents and adults want to know, like, what are the long term effects? Are we going to have any side effects that really outweigh the benefits? All of those are legitimate concerns and they are great questions to ask. And what I will always say is you need to talk to a medication management provider. So you need to talk to a nurse practitioner, you need to talk to your physician, you need to talk to a psychiatrist, right, to make sure that you understand all of those things. But medication is also a tool. It does help us. And there are times when we absolutely need the help of medication. Okay. So those are the three things that I'm talking about. I'm talking about therapy, I'm talking about assessment, and I'm talking about medication. All right. Hubby said mental health care includes treating the scars that can't be easily seen. Oh, that's such a good way of putting it. Absolutely. Absolutely. Treating the scars that can't be easily seen. Yeah. Which does not mean that they're not there. It just means that everybody might not be able to see them. Absolutely. Yeah. So, y'all, when we talk about mental health care, when we talk about the different ways that we try to help people in my field, one of the first questions, or one of the questions that I get a lot of times is, when do I seek treatment? Or like, when do I seek treatment for myself, or when do I seek treatment for other people, right? For my spouse, for my child, right? For my mother, my father, right? When do I seek treatment? First thing I always say is when you can tell that it is impacting their functioning. All right. So anytime you are going through something and it is impacting your functioning, you can receive help. You could benefit from mental health help. Okay. That doesn't mean that you have to get help, but you could benefit from help. So if somebody tells me, oh, I just have a thing about germs, like, I'm okay with everything else, but I really, really don't like germs. And they'll say, like, oh, I've been dealing with this my whole life. It's not something I really need to see anybody for. One of my first questions is going to be, is it impacting your functioning? Does it keep you from doing the things that you want to do? Does it stop you from going out and being with others? Does it cause you issues on your job? Or if it's a child, is it causing you issues in school? That's what we mean when we say impacting your functioning. Anything that you're dealing with that impacts your functioning can be addressed with mental health care. So, therapy, sometimes even assessment is needed so you know which way to go in therapy. And then, depending on how serious it is, sometimes medication is also needed, right? Another one is if you just want support. So I tell my patients all the time when they say, like, oh, well, only crazy people need therapy. One, crazy is not a word that I really allow in my therapy room. And not because, I'm like in some way disrespected by the word. That's not it. It's because it doesn't tell us anything. So when you say somebody's crazy, you can mean anything, right? If somebody else uses that same word, they can mean something totally different from you. That word isn't descriptive and that word is derogatory. So crazy is not a word that we use. And when kids say, oh, you only people that are crazy go to therapy, one, I correct them about the word. And then we talk about how therapy could really benefit anybody. Any and everybody could be made better, and so to speak, with therapy. It's not just folks that have significant mental health concerns, all of us. And so that's where the support comes in. Sometimes people need support because they just change jobs, or they just moved to a different city or a different state, or they just got out of a long relationship or a really important relationship, or because somebody died and they're grieving, right? So none of those things would constitute a significant mental health disorder, but those are things that people could use support with, and you can get that type of support in therapy. And just a side note, right? Like I'm talking about adult stuff right now, but some of this stuff is also kid stuff. I have seen plenty of kids who have lost a grandparent or lost a parent or lost a sibling or lost an aunt or an uncle, right? And they are having difficulty dealing with that. Just because they are not an adult, it doesn't mean that they don't need someone to help them through that. It doesn't mean that they don't need professional support. Okay. If you all can think of any other reasons in as far as the support category, if you can think of any other reasons that therapy might be used as support, drop it in the chat for me. Okay. And then the third thing is for guidance. So support and guidance might be a little bit different, right? Guidance is more so I have a goal in mind and I need some guidance on that goal. So we absolutely have people that do career counseling. We have people that, you're a college student and you want to know which way to go as far as your college courses and what's the best plan of action. We absolutely have people who help with organization and what we call executive functioning. So, all of those things are things that can be addressed in therapy. And really, when you think about it, there are therapists, there are types of therapists and types of therapy for any type of concern. Okay. Hey, JJ Cub Helper. Yeah. So that's when do we seek therapy, right? We can seek therapy when there's an impact on our functioning. We can seek therapy when we need support. We can seek therapy when we need guidance. And then there's how do we seek services? So, y'all, this is the part that really causes some issue, right? There are, if you don't know the process, there can be a lot of barriers to accessing this type of help. And since the pandemic, everything is longer. There's a wait or longer wait for everything now. So, if you all didn't know, I'm sure you did. I'm sure you've seen this on the news and seen other people talk about this. But all of the mental health concerns kind of increased since COVID, right? So, there was an increase in depression, an increase in anxiety, just in our general population. There was an increase in social skills deficits, not just for kids, but also for adults, right? So, the part about COVID, of course, the trauma of people having COVID and dying and all of the anxiety around whether or not you would get it, all of that was there. But then there was this other piece, the impact of having to be secluded, having to be kind of off to yourself, right? Even if you were in a family, your family couldn't really go out and do and interact like they used to. That takes a toll on our mental health. Because y'all, and you all have heard me say this before, no man is an island. We weren't created to be here by ourselves. We were created to connect. We were created to have interactions with others. And so it's not surprising that COVID and all of the having to be in the house and be by yourself, that took a toll. And we are still seeing the impact of that. Absolutely still seeing the impact of that. And so, because of all of these emotional concerns, the wait to see a mental health provider has been extended, like significantly. And so, what I tell people when they say, oh, well, should I wait, or how long should I wait before I seek services? Don't wait. When you first notice an issue, go ahead and do something about it at the time. And because the process might be so long, you want to go ahead and initiate the process. Now, what does that look like? That could be you asking your PCP for some help. That could be you, if it's for your kid, asking the pediatrician. That could be asking someone at your kid's school. That could be you going to other providers that you have access to and asking. You can also check with your insurance company. They will give you a list of providers that are within your insurance, so you can make sure that you can kind of keep the costs low. Right? There are a number of ways. Reaching out to people that you know that are in mental health, like me. I always tell folks, if you need some guidance, DM me. And y'all, that makes me think about what happened on the trip to Mobile. So on the way down, I flew into it wasn't Orlando. I flew into Florida. Right, it's about an hour outside of Mobile, but I flew into Florida and I flew through Charlotte. So on my flight from Charlotte into Florida, I sat next to this guy and we had assigned seats, right? Sat next to this guy. He was a really nice guy. We talked for a little bit. And he said that he was going for a wedding and I was going for this conference. We talked for a few minutes because if y'all know me, y'all know I like to talk. And then that was it. On the way back, I bump into him in the airport at the gate. And I'm like, oh, wow, we're on the same flight again. And so, we kind of laughed and kept moving. So we get on the flight, we're sitting next to each other again. And so now I'm like, okay, God, what's happening here? What's going on? And so we both kind of laugh about it. I sit down and he asked me about the conference. He said, oh, how was your conference? I told him it was great. He asked me what I spoke about. I told him. And he said, oh, wow, that could be helpful for everybody, not just women. And I said, absolutely. I asked him about the wedding. And then he said, so what do you do for a living? And so, y'all, this is interesting because a lot of people that I know who do what I do not share that, especially in situations like this, because people will then want to tell you their whole life story and they will then, sometimes try to get like free services, right? But I felt led to tell him what I did. And so I told him I was a psychologist. And he asked me what types of disorders did I work with. And, I rattled off everything: ADHD, depression, anxiety, parent child conflict, divorce and families, all of that. And he said, do you deal with bipolar disorder? And I told him, yeah, sure, And we went on to talk, and come to find out, he had someone really close to him who was dealing with bipolar disorder and had recently gotten a diagnosis, and he was looking for a therapist. Now, I don't see people outside of the institute where I work, but I did take down his information and I did help him, like point him in the direction, because I have a colleague that's in the city that he's in. And so I was able to help him, hopefully get this person some services. But y'all, God is always playing chess when we are playing checkers, right? Like, it was just so amazing that it lined up that way. And it was so indicative of a lot of other situations that I've been in where people know they need some help, or they know somebody else that they love needs some help, and they just don't know what to do. They don't know where to start. And so, definitely, if you have resources like a psychologist or a counselor or a nurse practitioner, whoever, reach out to them if you need to know where to start. If you need to know who you might have in your area that can help you. Okay. Also, with this, like I said, start as soon as possible because there are large wait lists. And what we see a lot of times in therapy, people wait until they're in crisis to want to get help. Well, if our wait list is about 6 to 8 months long and you're in crisis right now, my services aren't going to help you, right? But if you start when you first see that there's an issue, then you, by the time it gets to the place where you really need that help, hopefully that's when you will have already started with therapy, right? Or you will have already started with the medication management provider. So start sooner rather than later. And then I've had some people say, well, I called one place and they said they had a year's wait. And so I just decided not to put my name on the wait list. Y'all put your names on the wait list. Put your family member's name on the wait list. If there's a 1 year wait right now, you waiting and calling back in 2 months, what you think the wait gonna be then? It's probably gonna be 12, 12 to 14 months. So go ahead, put your name on the wait list, put your name on multiple wait lists, and whoever calls you back first, go with that person. But we really got to make sure that we're as proactive about our mental health as we are about our physical health, right? So if somebody told y'all, you know what, you need to go see a heart specialist, y'all getting on the phone going to see, okay, let me find one. Who do you recommend? Let me go ahead and call. Oh, that appointment is 6 months away. Well, can you put me on the cancellation list? You are going to move when we're talking about major organs, right? Move like that about your mental health. If you know that you have been sadder than normal and it is impacting your functioning, and even when you try to be happy, you're still sad, that might be depression. All right, let's go ahead and get it checked out. If you know that your thoughts are running all the time and it makes it difficult for you to sleep, and you are withdrawing from people that you used to lean into, you're withdrawing from situations that you used to lean into, that could be anxiety. Let's go get it checked out. And this is my one of my soapboxes. If you see that your kid is struggling, let's not automatically assume that this kid is lazy. Let's not assume that the kid just doesn't want to do their work. If they're telling you, I can't understand it, or mom, dad, I meant to do this, but I forgot. Don't just think that it's an excuse. There could be something there that needs to be addressed. So let's go ahead and get them an appointment. Okay. And y'all, there are so many different diagnoses and so many different mental health concerns. If you all have questions about specific ones, absolutely let me know. If you want to drop it in the chat, you definitely can. I know the people that I see on here right now, these folks are well versed because these are folks that I talk to all the time. And like Bri, it actually works with me. He does the same type of work that I do. But anybody that's watching the replay, if you want to know about a specific disorder or a specific concern, you can DM me and I will absolutely set up a phone call, or we can talk via DM. Or if you are fine with dropping it in the chat, drop it in the chat, and when I see it, I will absolutely answer it. But one of my goals, and this was a question that I put on social media on May 1st, how are we going to increase awareness for mental health care and mental health concerns? One of my goals is to make sure that everyone that I know, everyone that I come in contact with, understands the impact of mental health concerns and understands that there is help. And they also understand the process for that help. And so, y'all, I take that very seriously. I always have. And so, I do that in a number of ways. One way is to do Dr. CC Says, right? Another way is Heart and Soul Mental Health LLC. That is my business, that is my baby. And it was created to increase awareness of mental health care and mental health concerns, specifically in communities of color. So, not just communities of color. Of course, I want everybody to win, I want everybody to be healthy. And I am focused on communities of color because I think we don't always understand that we have some things at our disposal that we can use to help us be happy, healthy, and whole. Okay. I also do workshops. I also do presentations. I do vendor events like the Healthy Kids Day at the YMCA. All of those types of things. Next Tuesday, I'm actually going to be on a panel about the effects of COVID on mental health for the Baltimore County alumni chapter of Delta Sigma Theta Sorority Incorporated, the best sorority in the land. Okay. So I do things like that. I have a women's conference coming up. You all know about that, and I'll be telling you more about it because it's gonna be amazing, y'all. It's gonna be amazing. So I will tell y'all about that journey as well. But I'm doing those types of things because I want us to win, y'all. I want all of us to level up. I want us to know that God has some amazing things in store for us, and we need to be at our best to carry out those things that God has for us, right? So we all have assignments, we all have purpose, and we can do them even when we're not at our best, but we're not going to do all that God has for us to do if we're not at our best. So, y'all, we can do exceedingly abundantly above all that we could ask or think, and we need to be healthy to do that. All right. So, y'all, that's about all I have for you today. Next week, I think I want to talk to our mental health providers specifically, and I might have a special guest on next week to help me do that. But all this month, you all be checking out my social media. I am going to have data, percentages about mental health concerns in our communities. I will have that type of stuff posted. And I'm also going to have some questions and some challenges for people. Like, how are you increasing awareness in your own community? How are you increasing it in your own household? Are you all talking about mental health concerns? Are you all allowing space for people to feel comfortable talking to you? Right? Do our kids know that therapy is a resource? Or do they think that that's just what happens when they're bad? Right. So, how are we talking to our kids? How are we talking to our loved ones about mental health resources? All of those things are the things that increase awareness and help us to be happy, healthy, and whole. All right. So, y'all, that is my time. I hope you all enjoy your weekend, and I will see you next week. All right.